So we talked about what its effect is on your body. Now we're going to talk about what you can do about it. So monitoring your blood pressure. They have back there these lovely little cards. Grab a few of those. Get yourself one of those automated blood pressure arm cuffs. Don't get the wrist ones. They aren't as accurate. I just read some recent research on that. The ones that go on your upper arm are better. Make sure you're seated and calm for a few minutes before you take it, your feet flat on the floor, and your arms in a neutral position like this. It's not down, it's not up, it's neutral, okay? And start tracking it. Track it in the morning, track it in the afternoon, track it in the evening, hit and miss. Go to your doctor with a few weeks worth of pressure readings and he'll kiss you right on the forehead and say, "Thank you for bringing me data." And that will help him get an idea of where you are. And then salt consumption, that's a huge thing. We'll talk about that more a little bit. The daily moderate activity, we'll talk about that. Stress, I was talking to someone very nice about at the beginning of this lecture before we started about stress in life. And stress really does have an impact on our body chemistry, and that can affect our blood pressure. Stress can release. Oh, if only stress reduced, I would be Twiggy. And only a few of you are old enough to know who she is. But anyway, so stress releases cortisol, catecholamines, these really bad stress hormones. They cause constriction, and it's really hard on your blood vessels and your heart. And so it's good to do things to take care of your stress. And there are so many ways, and I have an expert sitting in the audience who knows how to teach about stress reduction. He teaches it for our cardiac rehab folks. Whatever is going to work for you, I just would ask you to make it intentional. I know not everybody has religious leanings, but I think there's a spiritual side to most people. And so if you nurture that spiritual side, whether it's yoga or meditation or prayer or service work or whatever it is for you, that kind of nurturing of your spiritual side helps reduce stress, along with the other things you do to help control your blood pressure, like exercise and all those good things that release good chemicals in your body will help with stress. But stress is really important. I remember back in the, it was the early 90s, I was teaching CPR first aid classes like crazy for the community, and the American Heart always said that stress was a risk factor for heart disease. And I remember saying something to that to a cardiologist at the time, and he goes, "Nah, stress isn't a risk factor for heart disease." But what does the research say now? Totally backs me up. I just am fortunate to live long enough to be right about so many things. Weight and diet, we'll talk about that. Compliance with medications. I cannot tell you that this is one of the things that's so important. So many people get prescribed their medications and then they don't take them, or they think I can skip the medications because I'm feeling fine, or I don't, this whole mail order thing through my company for my drug refills, this is a hassle. I'll just let it go. I'll take care of it later. Taking your medications is the biggest thing you can do, to take them regularly as prescribed, and then still monitor your blood pressure on the side to make sure they're still effective. And then if they're not, then you need to communicate with your doctor. Really advocate for yourself. And then knowing your numbers.